Hello again. I am Aditi Dubey. Let's begin today's episode with a question. What would you do if the treatment you need is across a border? Would you travel 500 kilometers for a chance at a longer life? Would you leave behind language, comfort, and familiarity for the hope of cutting edge care? This is the reality of thousands of cancer patients in Europe. Because the European Union is not just a political project, it's a health experiment. With 27 countries, dozens of languages, and one big idea: freedom of movement. Under European Union law, citizens have the right to seek medical treatment in other member states. That includes cancer surgeries, radiotherapy, and access to clinical trials. And with a cross border healthcare directive, patients can even claim reimbursement from their home health system under certain conditions. Sounds promising, doesn't it? But behind that promise lies complications. Let's break it down. In theory, cross border cancer care allows a Polish patient to access a rare immunotherapy in Germany, or an Italian woman with ovarian cancer to enroll in a clinical trial in France. It means options, specialization, and hope, especially for those with rare cancers or complex needs. In practice, though, things get messy. First, there is bureaucracy. Patients must often get pre authorization for treatment abroad. They need referrals, forms, proof that the same care isn't available at home, and the ability to navigate a labyrinth of documents. Not easy when you are sick. Then there is language. Consent forms, side effects warning, aftercare instructions, all in another tongue. And if something goes wrong, who's responsible? The foreign hospital? Your home insurer? The EU? Gets even trickier with continuity of care. What happens after you return home? Can your local oncologist follow up on an experimental drug protocol begun abroad? Will your health system cover the rest of your treatment or call it foreign medicine? And then there is the quiet inequality, the geography of access. Not all patients can travel, not all can afford accommodation, airfare, or time away from work and family. So while European Union law may guarantee the right to a cross border care, the ability to use it often depends on class, education, and circumstance. Now, let's take a step back and look at medical tourism, a growing industry where patients choose to go abroad for cost or quality. Germany and the Netherlands are destinations for state of the art oncology. Hungary and Czechia are known for affordable diagnostic. Private clinics cater to international patients, offering everything from PET scans to full chemo regimens. But here too, the line between choice and necessity blurs. Some patients travel not because they want to, but because they must. Waiting times at home are too long. A second opinion is urgently needed. Or the only specialist for a rare cancer lives 2 countries away. So, what's being done? The European Union is trying to harmonize digital health records and referral systems. Cancer centers of excellence, like those under EU Cancer Mission and ESMO networks, are promoting cross border collaborations. Pilot projects are testing telemedicine bridges between regions, and there is increasing talk of European reference networks for rare diseases. The vision is bold: a Europe where borders don't block care but guide patients to the best possible help, regardless of nationality. But that dream still needs work. Because health mobility is not just open highways, it's about trust, coordination, and equity. It's about remembering the patients aren't cargo, they are human beings, moving not for leisure but for survival. And at its heart, the issue asks, can Europe truly unite when illness divides? I am Aditi Dubey, and this was episode 13. Thank you for traveling with me across borders and into lives.